So next we have Mr. Bhaskar Bhowmick from IIT Kharagpur and Rajendra Mishra School of Engineering and Entrepreneurship, and he has some real-life experience about Indo-Finnish global cooperation. So please share your thoughts.
Thank you. Very good afternoon, and I welcome you to the Indian part of the innovation. As we have been saying that the reason I'm here is that to tell you that specifically the higher education institutions in India has come forward proactively to not only writing papers, researches, building models. They have come proactively to actually identifying models and implementing the models, the requirements of today. Now we are concerned about this, where actually the innovation, we thought the innovation is required, the level in terms of the environment, health, education and energy. We are committed to look into the finding the different solution of that. I'm giving one example that we have experienced ourselves implementing the models, and we'll come to the next. So our innovation in terms of design and develop scalable, inclusive delivery models, which must be having some availability, affordability, accessibility, and the quality. For example, we have created, the health sector. We have been talking since morning the health sector in India, giving one simple statistics. The statistics says today there is one doctor against 1600 patients today in India. So it is required to go to the patient rather the patients coming to the doctor's place. So we had created kiosks. This kiosk is nothing but giving an identifying, giving initial patient data and sending them if required to the hospitals or sending their data to the hospitals as a gift. We are working on the system. We are in the kiosk number 1, kiosk number 2 and 3 are in design process. Kiosk 3 will be almost a micro hospital. That is what we are working on. We are already having a collaboration with Finland. You can see that University of Alliance in Finland with University of California, Berkeley, and IIT Kharagpur has already come up in terms of identifying the delivery models and giving the delivery models, optimizing healthcare delivery. So it is inclusive. In fact, I started talking about where the scale lies. I identified 4 sectors. Scale is there required, scale lies there, and innovation is required. It is inclusive because we have identified entrepreneurs to run the kiosks, which are basically the rural medical practitioners. We call it RMP. So we created an innovation ecosystem that is in practice. Now what next? We are thinking, we actually created a lot of capability. We created some facility at our end. So we are going to the next level. We are trying to create a resource creation platform. You can see we have TBI lab, that Technology Business Incubation Lab. Sir is here, funded by TST. We already have the GVL Global Venture Lab with the Alliance of Universities. We have our school, Rajendra Mishra School of Engineering Entrepreneurship has created Innovation Lab, which is again unique in Indian context. So we want to create a resource creation platform where actually these companies, whether it's a Finnish company or Indian company, can collaborate with us. We have identified some areas, but I think it is beyond that.